welcome back to the Tooth Doctor YouTube channel. I'm Trevor, and this is the one and only amazing Dr. Peter Yoo, the Tooth Doctor. And today we're going to be talking about alternatives to braces. Now, Jana Cachola says, eyes are the windows to the soul, and a smile is the mirror of the heart. Doesn't everybody want a nice, big, bright, straight smile?
Happy person is a caring person.
Absolutely. And if somebody's giving a nice big smile, it just makes them feel confident and good about themselves, and you want to meet them, right? So here's a quick stat for you. Over 4 million people in the U.S. wear braces, and 25% of those are adults. Wow, kind of a cool stat. So tell me, what is your history with helping patients get straighter teeth?
My history? Well, I worked for a dentist in Camrose.
Okay.
And worked there for 5 years. Loved the practice, and he's a great dentist and taught me a lot. His passion was surgery.
Okay.
Implants, wisdom teeth, I guess. Yeah. He liked the crazy stuff, so to speak. So, from there I was like, what can I do? I like surgery, and I like placing implants. But I was like, let's branch out and see what there is. And Invisalign just happened to be on the radar. And I was like, wow, this is amazing. I think this is the new thing. Straightening teeth with invisible trays. A lot of benefits to that. And so that's why I went after it.
Awesome. So we know that Invisalign is an alternative. What are some other alternatives to regular train track braces?
Some other alternatives, I guess those are the only two that come to mind when you're older. Right. Now, the key thing is older. What can you do when you're younger? And for me, number one is prevention. Are there things that we can do to prevent braces or help our teeth grow as naturally straight or natural as possible, right?
Yeah.
So, I believe that people that have crooked and crowded teeth, it's not natural. It's because of certain habits and things that we do when we were younger that has led to these situations and causes. So, yeah, number one is prevention. With that being said, are there things that we can do when it looks like things are not going to come in properly? Yes, there are appliances. We also provide a myofunctional appliance, which is a muscle function. It's correcting the muscles and habits of the muscles so that the teeth will develop the proper way.
Wow, that's a first.
Mm-hmm.
It's really good. So what is the best time to start with aligners and other alternatives to braces?
To be honest, 2, 3, 4 years old.
Wow.
We get kids coming in and we look at them. My son, when he was 2, 3 years old, he had all his baby teeth come in. He had an underbite, so he was riding like this.
Oh man.
And I say this to all my patients because it's like a joke. Because my teeth aren't like that. My wife's teeth aren't like that. So I'm looking at my son, I'm like, he has an underbite. Who's the father? But understanding that your mouth is a result, or your teeth are a result of how your mouth works, I understood that proper breathing will correct things. And so that's what I did. I just got him to breathe properly, and his underbite corrected itself. I've had a number of dentists come in. When I shared that story, they're shocked. They're like, what did you do? What did you do? So, so you have to come in and see me to understand what I really did.
Yeah, he's a wizard. The dental wizard. So I know we talked about different appliances, and you've used one of these with our children, and it works really great. The T4K aligners for kids. Is that a major thing that you get people started on?
I am trying to get that worked on and becoming a key part for child development. I don't want kids having to pull out teeth or having pain when teeth are removed. And this appliance, all it does is it trains your mouth to do the right things the right way, And from that, the end result is that your teeth actually straighten out. They come in the right way, I guess, so to speak.
More naturally, and then not having to spend thousands of dollars in multiple visits with an orthodontist later on. Sorry, orthodontist. So, what do you recommend for adult patients who want straight teeth? Obviously, Invisalign is your go-to. Tell me a little bit about, who is the ideal client for Invisalign? Like, if you have, like, how bad can your teeth be and still work in Invisalign?
Invisalign, I used to believe that Invisalign fixed, the minor crowding, but there are a number of patients that I'm working on that we are doing some major movements and major straightening. I've had patients up to age 63 that I've used Invisalign and gotten some great results. And you got some patients, this one patient I have had the vampire teeth, and we basically moved the back teeth back and created space, and this person's teeth, their smile looks fantastic.
Wow.
Parents were shocked. I personally, I was actually a little bit shocked too. I was like, wow, this worked. Wow, and again, just understanding the physics of what you need to do to move teeth and get them aligned. I think Invisalign works for almost all cases.
Wow, that's amazing, and that's good news, because having straight teeth is a big confidence booster. Some people don't smile because they don't like their teeth. They don't like how they look, and that's sad. And if there's a way to fix it, then let's get on that, people.
Yes, for sure.
Yeah. So, are orthodontists the only ones who can prescribe Invisalign for patients?
There are many orthodontists that do Invisalign and braces. They are very well equipped, but there are a number of dentists that have been doing it for many years. A lot of when we go to these Invisalign conferences, a lot of the speakers are regular dentists. They just kind of took it on as a passion, and they've treated sometimes 1,000 people a year. And so Invisalign is for the dentists that feel comfortable and qualified, and they just want to make it work for their patients.
Awesome. So it's a great alternative, and a lot of dentists can do it. You do it and do a fantastic job. Your patients, I'm sure, are smiling when they walk out the door. So now with Invisalign, how long do people have to wear them? Like, is it a 3-year process like with braces, or is it shorter?
Well, they say on average with Invisalign, it's about 11 months.
Okay.
So we've had some patients where we finish them in 5-6 months. We've had patients where they've taken almost 2 years. So the thing that I enjoy or appreciate about Invisalign is that it's a guided movement. You know that from one tray to the next tray, they can only move a certain amount. They can only rotate a certain amount. So you know that everything is moved with accuracy. It's not just kind of guessing. And so the key thing that I feel or I like about Invisalign is when people go from one tray to the next, they actually have very minimal pain. Okay, and that is a key thing, because when you're moving teeth and you don't feel pain, you know that it's moving in regards to the health of the bone and the person's biology, right?
Okay.
When you're pulling teeth and using braces, if your teeth are really hurting, that's a sign telling you, hey, you're moving me too fast. And again, there are patients there where their teeth come out and everything looks great, but I have seen the ones where the roots actually shorten. So if you move a tooth too quickly or too much force on a tooth, instead of pushing the bone and then moving the tooth, you're actually dissolving the root of the tooth.
Oh, yeah. That doesn't sound good at all.
That's very serious.
That sounds like a very, very bad thing. So the question now is, what are the biggest benefits to having straighter teeth?
Benefits, big thing is overall health.
Okay.
I'm a person about health, about long lasting. I always tell my patients, I want you to keep as many teeth as possible for as long as possible and for as cheap as possible. So having straight teeth, easier to clean, easier to maintain, less food gets stuck. When you have, I have some patients where they have some really, really crowded teeth, and in those places they've gotten some really big cavities, or they've actually lost a tooth because they were just not able to keep it clean. So, yeah.
So massive benefit to your health, making sure that you've got nice straight teeth and you can clean in all those crevices. I've got crowded teeth, so I understand all about that. Not very fun.
Yeah, but even just getting that long-term effect, and also it's not even just the ability to clean, but when you have everything in the right position, then things align properly. It's like driving a car. If you have a tire that's not balanced, or it was put on wrong, you're gonna get uneven wear, and then you're gonna have to change those tires sooner. So that's a key thing. And again, the biggest thing that people enjoy is just the confidence. They have a better smile, they feel confident, they feel great about themselves, and they can walk out with a smile. And that smile, it has a psychological effect on you. When you smile, you actually have, they say that you have endorphins and the chemicals in your body that just make you feel better.
Awesome. Well, that is a prescription for good health and a good life. So if you are interested in getting some Invisalign, definitely talk to Dr. Yoo. Go to the website at thetoothDoctor.ca. And that's all for us. If you enjoyed the video, give us a thumbs up, subscribe to the channel, and maybe leave a comment or two down below. And we'll do our best to answer those. Thanks, and we'll talk to you guys next time.